this study was one of the biggest adjuvant studies in kidney cancer. So we have this whole cohort of people who went through this IMmotion010 study, and what they did is, if depending upon the cohort they were in, they were stratified to either receive atezolizumab for 1 year versus placebo for 1 year in an effort to try to decrease the risk of recurrence. So the starting cohort is anybody whose tumor was taken out with intermediate or high-risk kidney cancer. So that would be grade 4 T2 or worse, including metastatic disease, as long as it could be resected. So at the end of this clinical trial, before the randomization, the tumor had to be fully resected and fully removed, and then they went on to either receive an immunologic agent, atezolizumab, or placebo. And the idea of this study was to see whether or not giving you immediate adjuvant IO would decrease the risk of recurrence. That is, would it improve disease-free recurrence and would improve overall survival? Unfortunately, that was a negative study. So that the addition of atezolizumab did not improve DFS. But what we did have in this cohort is a lot of serum. And so what we did is we took that serum and we looked at the various expressions of KIM-1 in the plasma to see whether or not that could be a circulating biomarker to help us identify patients better. And that's exactly what we found. If you had a high KIM-1 level at baseline, it was associated with a worse DFS, or worse disease-free survival rate in this cohort. So the higher the level of KIM, at baseline, that is pre-op, the worse those patients tended to do when it came to, they recurred more frequently, basically. And then additionally to that, if you got atezolizumab, in that group of people with high KIM-1 levels, you tended to do better, than if you had low KIM-1 levels. In fact, in that subgroup of people that had high KIM-1 levels pre-op, they had about a 28% improvement in DFS, when they received atezolizumab versus placebo.